Hello everybody and welcome to Healthy Baby, Healthy Mama presented by Kaweah Health, your parent portal to help you prepare for your bundle of joy and unravel the tension that comes with this exciting new chapter for all parents. We're here to help you with our health experts and other parents themselves. So grab a snack, sit back, and let's write this pursuit of healthiness together. We're very excited. Welcome to our very first episode of our podcast. I'm Maria Rodriguez, your host, and I'm excited to present our very first topic of the day, breastfeeding, with mother, baby, nurse manager, and mom herself, Stephanie Genetti. Welcome.
Thank you so much for having me.
We're excited to have you because this is such an important topic for moms, parents in general. I mean, breastfeeding is not easy, so why should we do it?
You know, it does tend to be somewhat of a labor of love, and we understand that. I work with a fantastic team of healthcare professionals, educators, and it's something that we're passionate about. So we don't just do it because we love it. We are an evidence-based practice. So, I work with a certified and licensed lactation team, and we have found through, years of study that the benefits of breastfeeding include, reducing risks of sudden infant death syndrome, the potential for later type 1 diabetes, obesity, asthma, aside from all of the wonderful bonding benefits. So it's something we're very passionate about, and we understand it can be difficult. So we're here to support that.
I love that because a lot of the times people, you see commercials of breastfeeding, it looks like it's all rainbows and butterflies, but it isn't. It's a journey. So one of the most common questions that we hear mothers ask is, does it hurt?
Right. It's a loaded question. So one of the amazing things that we offer is education prior to the admission. And that's available to everybody online, and we'll share some of those resources with our viewers.
Perfect.
But the simple answer is there's not really one, but it doesn't have to hurt. So oftentimes the notification of pain from a patient kind of triggers us to say, okay, let's take a look a little closer and see what kind of assistance and support we can offer to help alleviate that. So it's not an uncommon thing to say, this is uncomfortable. I didn't think it was going to feel this way, that type of thing. But we are trained to be able to identify, okay, let's see what we can do to help fix that latch and help, reduce the discomfort.
We're talking about, does it hurt, the experience for mom, but you as a mom, how many children do you have, and did you go through this experience yourself?
So I am a mom of 3 children.
Aww.
And I breastfed my first one for about 8 months. And it was difficult. I wasn't a nurse yet. I knew I was passionate about breastfeeding. I really had not considered anything other than breastfeeding. But when I had my child, he was a large baby, and we had some blood sugar concerns that were brought up by our provider. And so it was something that we had not planned for, which happens so often with motherhood. It was my first time, and I recall being the patient and having a lactation consultant come in and meet with me and just thinking, oh, they're just such a gift, because it encouraged me. It made me feel like, okay, I have someone who understands what I'm struggling with right now. And so I can also say with each of my children, that journey's looked different. With my middle child, she had what we call a tight frenulum, more frequently known as tongue-tied. And so that was challenging with breastfeeding, and that did cause a great deal of discomfort initially. Again, I had great support from my providers that were able to identify that and help me come up with some strategies while I waited for more of that mature milk to come in. So by the time I had my third one, I was a labor and delivery nurse, and I was like, okay, I've got this. I'm seasoned. I've done it with the previous one. This is going to be a piece of cake. But it was still a journey. Every child was different, and they had their own way. But again, with the great support, the education, the reinforcement, sometimes just somebody saying, we understand. And it's not, you're a little sleep deprived. You've been through a delivery of a newborn. So it takes a village. And that's what we're here to provide.
I love that you kind of went through each one of your different pregnancies, all 3 pregnancies, and how different that was for you, because like you said, for every mom it's different, every child is different. And when we go to the unit, to mother baby unit, we see moms and they're delighted to have their little bundle of joy, right?
Right.
But there's so many other things that involve the care.
Absolutely. We try to establish at the time of admission, what is it that you're wanting? What are your preferences? One of those things that we discuss is, how are you going to feed your baby? It's our hope that we're able to identify very early on, these folks want to breastfeed, these folks want to formula feed, these ones aren't sure. And what we do is we take this team approach centered around the patient, and we come up with unique plans to each patient that will hopefully help them to be successful in what they determine is best. And we try to ask that before they've been super sleep deprived and uncomfortable and all of these things that definitely play a role. And then we just do our best to help support that, and we modify the plan as we need to.
That's amazing, because you guys tailor each plan to the patient. Are there conversations before the delivery when the mom comes in? Is there ever questions about, how is this going to work? What should I do? What kind of advice would you give a mom, especially because every delivery, every breastfeeding experience is different?
Right. So it is the goal of our lactation team to have a consultation prior to delivery with every single patient that's admitted. So we have a lactation team of 3 professionals that have some staggered hours to try and accommodate as best as we can. In addition to that, every single maternal child health nurse has taken additional education to also be able to provide those services. So, we explain that if they've identified that breastfeeding is something that they would like to do, that right after delivery, we're going to do our best to place that baby skin to skin. It's a proven intervention that yields great benefits in terms of that first feed. Now, this is the baby's introduction to how this is supposed to go. So there's always someone, whether it's a nurse or a lactation consultant, that is there for that first feed to help establish what a good feeding is going to look like with a proper latch, hopefully with minimal discomfort, so that we are helping that newborn as well as mom to establish this is what this is supposed to look like and feel like. Our goal is to have that first breastfeeding take place within the first hour of birth. We do our best to be there and to make sure that bonding is happening with that skin-to-skin practice, and then we do our best to help the baby latch for the first time at just an hour of life.
Going through this journey, your body changes, your hormones change.
Absolutely.
Everything changes, right?
Yeah.
So what are the benefits for mom as well?
So aside from the fact that these moms' bodies, they just continue to be incredible, right? Yeah. They have done an amazing job of sustaining and providing for this baby for the entire gestational period. And in that same way, mom's body takes over and it's able to produce exactly what her baby needs, exclusively even for the first 6 months, which is breastfeeding. So, some of the physiology that's behind this is that some of the hormones that are released during breastfeeding, they help with mom's uterus to help it contract, which regulates blood loss. It also, can help get back to that pre-pregnancy size, which is what it's working to do either way, but it effectively helps that happen. There's studies that prove that breastfeeding also helps reduce the risks of breast cancer later in life. Just again, reinforcing that bond between mom and baby. And it's ready wherever you're at. There's no
wherever you're at.
Yeah. So that's pretty convenient once it's nice and established. And then for baby, again, just asthma prevention, type 1 diabetes, obesity, sudden infant death syndrome. All of those risks are reduced.
One of the most important parts that I think you mentioned, benefits for mom. When we think about breastfeeding, I would have never thought it helps to go back to your pre-pregnancy weight, which is one of the reasons why many moms have so much trouble, because your body changes. You don't feel like you did before your delivery, right?
Absolutely.
And so it was a shocker to me, but that's amazing.
It's an incredible plan, what our bodies are able to do naturally. And when I say naturally, that doesn't mean without great effort and work, some strategies and some help. But that's what we're here for, and that's what we love to help facilitate, even after discharge from our unit.
For any new moms who are going through this journey or watching or listening and are thinking, I want to do breastfeeding. It seems like it's going to be a journey, but I want to do it. How long should they breastfeed?
The recommendation is for, exclusive 6 months. We always say have a conversation with your pediatrician. We want to also encourage families to understand that you get to be the architect of this and really customize it for what works best for you and your family. But World Health Organization, the American Academy of Pediatrics, if we can get families to be on board for a year, the benefits are just amazing. But we also acknowledge that any breast milk for a newborn is a fantastic benefit. So we're going to encourage, as long as we can. But we also understand that for different families, that looks different. Some moms are going to be home for 6 weeks and return to the workforce. Others have longer, it depends on what work looks like, those types of things. So our lactation consultants are available, to provide outpatient consultations as well as over the phone conversations about strategies for everything and anything breast related. So that includes storage, pumping, all of those different things were readily available to help.
That's amazing. And I'm going to put a plug there because you mentioned something very important. You said no matter how, you were talking about breast milk, how important it is, no matter where we get it. There's actually human milk banks available for mothers and babies, mothers who can't breastfeed because maybe they're not ready, or like you said, the mom has to go back to work and just it's not readily available. Tell us what that is and how amazing that is, because it helps a lot of our babies, our littlest patients.
It absolutely does. So, we see the benefits of breast milk, and we've had to be innovative in terms of how do we provide this to everyone. So we see this with our very premature babies in the NICU. Sometimes mom isn't able to produce because this baby came a lot earlier than planned. Sometimes we see this with adoption, surrogacy, all kinds of different situations. Sometimes, there is just a reason why mom is unable or chooses not to, however, wants to still have the benefits of breast milk. So there is a Mother's Milk Bank that is located in San Jose, California, who we partner with, and we receive donor milk from pretty consistently here at Kaweah Health. I encourage those mamas out there that are weaning their children from the breast. It's something to consider. It's such a fantastic gift. So through this particular milk bank, you can be a donor, but you can also be a recipient. And so it's couriered over, and it's fresh and screened, nice and healthy, safe for consumption for our brand new babies. So yeah, it's an awesome gift.
I love that you specify and clarify that it's safe, because a lot of people might think, yeah, donation, people donate organs.
Right.
Why not donate the mother's milk, right?
Absolutely.
But do you know, or can you tell us what the steps are? Or is there any criteria that mothers have in order to donate?
So you have to be able to produce milk. So it's for lactating mothers. If you go onto the website, which we're going to provide, there's an initial questionnaire that helps serve as a medical screening. After that, they set up an appointment that can happen either, something like GoTo or Zoom, or on the telephone. When donors decide that they want to proceed with that process, what will happen is, there's then some lab work that's done, as well as an agreement that's established that clarifies what type of milk we're looking for. In this, it may provide some exclusionary criteria. There's certain medications and medical conditions that could potentially prevent someone from donating their milk. So this is all gone through, and then once the screening process is complete and the lab work comes back, then the donors get the green light to go ahead and proceed, and then they're provided with the guidelines of how they submit their milk deposits to the bank. Yeah.
It's beautiful. You're giving the gift of life through your milk.
Absolutely.
Right?
Yes, precious nourishment for these babies.
Are there any special precautions or measures that moms need to take to ensure that the milk is ready and safe for consumption?
It's absolutely safe for consumption upon delivery. All of the necessary checks and balances have taken place so that moms and dads can confidently share this resource with their baby. So in addition to receiving the milk, just some storage guidelines and preparation instruction, but other than that, it's absolutely safe.
Awesome. Now, what about moms who shouldn't breastfeed? What would that look like? When should a mom maybe not opt for this route and possibly do baby formula?
Sure. So, what our role is as healthcare providers is to provide information and education to each patient and help them to make a well-informed decision. So we ask a certain line of questions that helps us to ascertain whether or not this is something that mom wants to do. That's the first key component. We don't take any type of coercive approach. We share the benefits. It's something that we are passionate about, but at the end of the day, we want a baby that's healthy and well nourished, and that can happen with formula. So we are first confirm. I'll call it a partnership between mom and the staff. Yeah, this is something we're going to work at and proceed with. So mom's choice. There are certain health conditions that usually with routine prenatal care would be identified with your OB provider, where they would be able to say, hey, this particular medication won't be safe for breastfeeding. Potentially consider some alternatives, or say, this just probably is not going to be safe. We also have pharmacists here that are fantastic with the district that specialize in these medications that we commonly see, to help guide us to determine is this particular medication safe. There are certain health conditions, open infections, those types of things, chickenpox, an active case of chickenpox, those kinds of things where we're concerned about transmission to a newborn, where we may say, this isn't, the benefits don't outweigh the risks. So we help identify those types of things.
What about for a mom who is breastfeeding? Are there any foods they should avoid? Because obviously, during pregnancy, there are a lot of cravings. Absolutely. But what about after your delivery and you finally have your baby? You're probably still craving a lot of those delicious meals, but should everything be open and on the table, or should we avoid some things?
Sure. We get this question so often, and there's the general idea is that much like the placenta, there are foods, medications, alcohol, those types of things that are going to pass through and be, given to baby. So if you're, having some alcohol, that's going to be in your breast milk. There's ways to test your breast milk to determine that, but basically, if you've been drinking, that's not something that we want to encourage for baby. In terms of food, now we like to kind of loosely say everything in moderation. If you find something isn't sitting well with you or makes your baby particularly gassy, those types of things that's causing upset, then we're gonna say, yeah, you should probably steer clear of those things. But a hard and fast, no, not necessarily.
Is there any type of negative impact if they choose to provide a baby formula?
I think that the negative impact oftentimes is from mom's perception. If she had her heart set on it and for some medical reason or, just exhaustion, decides, this is harder than I thought, or it's, I have a really sleepy baby, or there's some kind of medical condition going on with baby where it didn't work out to plan. I think those are difficult on moms. The mom guilt starts right away and is very real. We can be really hard on ourselves. So I think there's more of that concern, more social. But again, a fed baby is what needs to happen. So, we have a good number of moms who come in and they say, I really want to breastfeed, but if for some reason it's not going to plan, I'm not adverse to giving formula. And so we know that that's part of the plan, potentially. We still try and get that great first feed in. We still want the skin to skin, all of those awesome things. But if mom's like, I have been up for a length of time, I'm feeling exhausted, I think I need a break, then we might help say, okay, like maybe we can do some hand expression and you can supplement with your own milk. Or if you're ready to give some formula supplementation, we're absolutely happy to support that.
I love that you touched on the mom guilt because it is real, right? Mm-hmm. And oftentimes mothers feel like, am I doing this right? Did I handle this right? I was told, I read about this.
Right.
And that's a whole nother monster that we can get into about everything you see online, the do's, the don'ts, what people tell you. I want you to touch a little bit about that. Not just as a nurse manager, you work with all of these moms and the team to help care for them, but what can you say as a mother about the guilt and how do we avoid getting consumed by this, right?
Yeah, absolutely. I think just understanding that it's okay for your journey not to look like someone else's. I think comparison is just a big pitfall. And I think identifying early, we ask, who's your support person going to be in labor? That support person who is identified, right now, we let 2 folks be in for delivery. And when we say support person, it's not just necessarily like who's the other parent. It's who understands what your plan is, who is being a cheerleader for you, and helping to emotionally and physically and be supportive of this. So, the mom guilt is absolutely real. We're aware of it. I think when your circle is behind you, it's always a good place to be. So I think making your choices known to that group is helpful. We were able to collect some really interesting data through the pandemic. We, like all facilities, had to consider, scaling back on the folks that we allowed to the various units. And emotionally, that was difficult for some of our families because, they had to choose between maybe mom and dad and those types of things, what grandparent, that type of stuff. But what we saw was our breastfeeding rates were just through the roof, higher than we'd seen in a really long time. So when we started to go back and have these conversations with some of the parents, less interruption, more time for bonding, more one-on-one time with the staff that was able to help facilitate what mom was wanting, less input. I know that's not popular.
We want to whisper that sometimes, but yes.
Sometimes we want to say it really loud for the folks in the back. Be supportive. Go along with what mom has decided is going to be best for her and baby. We have these grandparents who have the best of intentions mixed with experience. So they want to share it because they're passionate about these little ones. And they always tend to feel like they're crying, they must be hungry. When we actually find crying is a very late notification of I'm hungry. It's considered a late hunger cue. And that's one of the reasons why I really love the online class too, because it helps parents identify what are these hunger cues like. When a baby's being passed around from family member to family member who are all gushing about how gorgeous this new baby is, what happens is it's from this hand to that hand to the next, and baby starts to get a little fussy, and you start to hear a shh, 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 shh type of thing go around the room. Well, we just pacified that baby through a feeding. So then by the time we get to a crying baby, who is then more difficult to help breastfeed, all of these things can have an impact that works against what the original plan is. So all of those things, come into play. We have a lot of folks, even dads, who know, like, yeah, we did say we wanted this, but I just don't know if the baby's getting enough. Baby still seems hungry, right? So I brought this little guy with me. And this is the size of our newborn baby's stomach at one day.
Oh my goodness.
So a whole bottle in this is just going to cause a lot of spitting up. And, You know, we like to use these kind of visual aids with our families so that when they're saying, I don't know how much my baby got, it might have only been a few drops, and we check and see like, oh yeah, you have the supply here. I'm able to help you hand express, and I can see that. A few drops goes a long way.
That?
Absolutely.
Oh my gosh. Look at that. The size.
It's like 5 milliliters.
Compare that to your hand.
Absolutely.
Wow.
This isn't until a month.
Wow.
So when we're
difference.
considering the volume that it takes to make a baby satisfied, right? It helps put things into perspective. Those are the kinds of things we want to share with our families.
Well, thank you for sharing that, because I didn't even know. I mean, if you compare, what was the time difference?
This is at about a month.
And this is day one.
Day one.
Wow.
Yep.
And like you said, that's exactly why babies are hungry.
Mm-hmm.
And I also didn't know that when we're carrying, we have the family visitors. Everybody wants to greet and say hello to the baby and congratulate the parents. But carrying them can kind of, like you said, it was easing, and it kind of delays the hunger.
It can have the potential to do that. So those are the types of things we like to focus on. These are the hunger cues that you can identify in your baby that you can share with the family too. If you see this, like, it's time for me to try a nurse. And so that everyone's on the same page and armed with the same kind of education to help them be successful. So
we're getting close to ending with our first episode today, but I want you to tell us a bit about what we offer in our unit for mothers who want to breastfeed and are looking to the experts, to moms, right? Other moms.
Absolutely.
During this journey.
Yeah, I think that I'm obviously biased, but I think our mother-baby department is amazing. Everyone who works in the department is passionate about the service that we provide. We're invested in the success of our families. You know, oftentimes there's a little bit of correspondence that happens even after discharge, which we love. What I can say is that it's a judgment-free zone. And we're there to say, you're doing a good job, and we recognize that. And to help these new families find their voice and blaze their own trails. And it can look as unique as our patients are.
Who's part of the team?
Yep, so your OBGYN is definitely part of the team. Pediatrician is part of the team. We have certified nursing assistants, unit secretaries, on occasion some laboratory staff, the nurses, and the managers. We all work together. It's a multifaceted approach that's centered around the patient.
And I want to put a plug. We're also partnered with Valley Children's. So tell us a little bit about that and how that just elevates the care for our babies.
Yeah, you know, we have what are called pediatric hospitalists, as well as a neonatology team who are contracted with Valley Children's Hospital. There is one that's always present at the facility, 24/7. So, you know, it's an amazing partnership, same type of education, same type of policy that's reinforced here at Kaweah Health in Visalia. So all the benefits of Valley Children's and their knowledge here in-house.
That's amazing, because parents don't have to travel anymore. They can stay right here in Visalia, the same care, the same quality of care, and with the same compassion.
Absolutely.
I love that. So the very last question for today, Stephanie, what is the best advice you can give to first-time moms, dads, parents who are looking to this journey, feeling tension, feeling nerves, but may one day consider breastfeeding as an option?
You know, the best advice that I can give is to trust your instincts. Not to be afraid to do what's best for you and your baby. It's a practice right from the very beginning. You're developing a voice that is centered on the best interests of your baby. And isn't that what parenting is all about? Trying to do what's best, what's safest. We're trying to arm with knowledge and support. But ultimately, again, reinforcing that you are the parents and you get to make these decisions. So let us help you with this like-minded interest, which is of having a healthy baby and family unit, with just some education and all the support that we are so willing to provide. Don't be afraid to ask questions. Don't be afraid to dig a little deeper to understand the why.
Parents are not alone. They have a whole team behind them, besides the visitors, besides the family and the friends, experts like yourself and moms like yourself who have been through this multiple times. You know what it's like, and you know that not every situation is going to be the same, but the goal is always the same.
Absolutely.
Right? Well, thank you so much, Stephanie, for joining us on our very first podcast of Healthy Baby, Healthy Mama. You have been amazing, and thank you to all of our listeners who are tuning in. Remember, we're here to join you on this incredible parenting journey, and we'll help ensure that you have a healthy baby and a healthy mama, one episode at a time.
Absolutely.
Thank you so much. Until next time.